patient, an elderly person, who came to me, and he said, I keep getting headaches, and when I wake up, I keep getting headaches. I can't explain. My blood pressures are normal. I have done scans and I've really not had any, abnormality in it. And I have no stress. I have nothing. So I said, okay, wear a sensor. Let us see what is happening to
What's
you
happening inside.
in terms of your sugar control.
Yeah.
And to my surprise, although the daytime sugars were fairly good, right, his night sugars were exceedingly low.
Oh.
Right. And that was when he got up in the morning also, he got up with a very low sugars. And one of the manifestations a patient can experience headaches. We just brought down his medication dosages, ensured that he was not in the hyper range, and all his problems just disappeared. And then we have now something what we call as a continuous glucose monitor, where we attach a sensor to the patient and it measures the interstitial fluid glucose, which is in equilibrium with the blood glucose.
You recommend this blood glucose monitoring for, all patients who are trying to keep a control on their diabetes?
Every patient with diabetes should monitor his glucose. It's just a question of what should be the frequency.
Accurate kaun sa hota hai?
I think accurate is all of them, because the most gold standard is when you do a laboratory estimation of blood sugars. Now, when you put a continuous glucose monitoring sensor, you're actually able to match that which food is causing a spike of your blood sugar.
What if your body could tell you exactly how the food you eat, the stress you feel, and the way you move impacts your health in real time? Thanks to the advances of glucose monitoring technologies, that's no longer just a dream. From athletes to health enthusiasts, and of course, people managing diabetes. A regular tracking of blood sugar has become a powerful window into our body's inner workings. In today's episode, we are exploring the world of glucose monitoring, revealing truth, breaking down myths, and showing how understanding your blood sugar can actually unlock a healthier you. And today, once again, we have with us Dr. Sanjay Agarwal. With an incredible career spanning over 4 decades, he has not only mastered the art and science of endocrinology, but has also helped patients through his patient-centric approach. As a global thought leader, educator, and pioneer in groundbreaking clinical research, Dr. Agarwal continuously shapes the future treatment strategies worldwide. Today, we have the privilege of hearing from a man whose dedication, wisdom, and passion have set new standards in medicine. A true pioneer whose impact resonates far beyond the hospital. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us for the 3rd time,
Hi,
Dr.
Tushita.
Sanjay Agarwal. I don't even need to introduce you anymore. How are you, sir?
Pleasure to be here.
Welcome back.
Thank you so much.
We could
See,
not
you just
stop.
get me back, and you just have to say that I'm back here.
So, every time I do a podcast with you, and immediately the day after, I realized that, "Arey yaar, ye bhi puchna chahiye tha. I should have asked him this also." So I'm pretty sure iske baad bhi I'll have some more thoughts. So looking forward to having you again.
Let's keep it going.
Yeah, let's keep it going. So today we are going to talk about glucose monitoring, sir.
Lovely
because,
topic.
We have spoken about weight management, we have spoken about so many other things. And everywhere, continuous or, a regular glucose monitoring plays a vital role.
Absolutely.
So we'll dive into that. So before we get into the criticalities of it, what exactly is glucose monitoring and how it happens?
So it is very important to know your blood sugar levels, right? Because once you know the blood sugar levels, you are able to make a lot of decisions. First, based on your blood sugar levels, we are able to make diagnosis of diabetes, right? Having said that, if you have diabetes, then again, based on your blood sugar levels, we decide the plan of treatment for you. Based again on your blood sugar levels, we decide how good your control is.
Yes.
And do you need change of therapies? And then based on again blood sugar levels, we decide that what is the risk for development of diabetic complications.
Okay.
Right.
Okay.
Now there are various ways that we can, decide how we can monitor your,
Blood glucose
yeah,
levels.
diabetes levels for that matter. The most common thing that we do is a instant blood sugar check by a glucometer, by a finger prick. Right. The other matrix of monitoring is HbA1c that we do, because that's an average of blood sugars over the last 3 months duration of time. And then we have now something what we call as a continuous glucose monitor, where we attach a sensor to the patient and it measures the interstitial fluid glucose,
Acha.
which is in equilibrium with the blood glucose. So this is like a continuous, it may have, depending on the type of sensor that you use, it can be all the way from a single week to 15 days. It can be up to a month, it can be 3 months or even 6 months. So a lot of now newer sensors that have come in, these are implantable sensors and they can be monitored over a 6 years duration of time. So these work well. So I think the world is changing, and we do want to see that patients measure their blood glucose more, because it gives us an idea about how well they control that.
So you recommend this blood glucose monitoring for, all patients who are trying to keep a control on their diabetes?
Every patient with diabetes should monitor his glucose. It's just a question of what should be the frequency.
What should be the frequency?
Right? But it gives you an idea of the overall control of the patient. And only if you have a good control, your A1C will also be in target range, which is going to help to offset future complications.
So the next question ना मेरे को एक मतलब बहुत स्पेशल रिक्वेस्ट में आया है फ्रॉम वन ऑफ माय फैमिली मेंबर. इनमें से एक्यूरेट कौन सा होता है?
I think accurate is all of them, because the most gold standard is when you do a laboratory estimation of blood sugars. When you do a finger prick, you're looking at a capillary blood glucose. And when you do a lab reading, you're looking at venous glucose, right? So very often people get confused that my sugar that I test on the glucometer is not matching
The one which is
coming from the
lab.
laboratory.
Yes.
So you have to remember that number one, the samples are different, and the method of testing is different.
Is different.
So you may have as much a variation of 10% from the lab readings when you do a glucometer.
So 10% of reading is difference.
Yes. Again, when you do a continuous glucose monitoring with the sensor, you're looking at interstitial fluid glucose. Now that lags behind blood glucose. So at same point of time, when you look it on your sensor and you do a blood glucose, the two will not match, because it takes time for the interstitial fluid glucose to reflect what the blood glucose had. So you need to understand certain limitations of all these monitoring.
But overall, a range of around 10%
Yes.
of thing
Yes.
is okay.
Yes.
So this blood glucose monitoring, right? How does it impact the outcomes of diabetes?
So if you have been monitoring your blood glucose pretty periodically and frequently, you're able to make clinical decisions on the treatment and the intensification of treatment or de-intensification of treatment, right? And if you keep your blood glucoses level in the target range, you're able to get your A1Cs also good range, because today we know that absolute values are important to see that what is your risk for complications. Equally important is the fact that if there's a lot of wide variations of the blood glucose, intraday and interday, they are also equally responsible for diabetic complications. So unless you're monitoring frequent in the day and in between days, then you will not be able to pick up this glycemic variability, which will blind you to the fact that, okay, can this lead to an increased incidence of diabetic complications?
So actually that was bringing me to the next question, that how frequently do you recommend your patients to do this?
So we say that, okay, optimize depending on the resources, because today glucose monitoring strips, although they have become cheaper, but they still carry a cost to it. True. So a lot of people where, cost is a constraint, they would sacrifice monitoring to buy treatment. True. Right? So in these sort of situations where the money has to be spent more on purchase of medications, we say at least intermittently keep monitoring it to know where you are in terms of control. So there we'll allow the patient to choose that they may do some days only fasting, some days only post meals, some days only pre-meals, and depending on which time of the day they want to do it. That's because we save out on the costs.
And
right?
also, I believe it helps a lot in planning the diet chart for the patients.
Absolutely. So, other times we say that if you're affording, then if you can do it before and after meals, that's breakfast, lunch, dinner, and 3 o'clock in the morning, you have a 24-hour window of how the sugars are behaving.
Yes.
You can understand when the sugars are down, when it is high, is there a lot of variability, and you can match that. Now, when you put a continuous glucose monitoring sensor, you're actually able to match that which food is causing a spike of your blood sugar
Yeah.
and which is not causing a spike, because you can real time see your blood sugar values.
Yes.
So people use that very effectively because whenever they eat certain kinds of food, they are able to check, has my sugar gone up or not, and they're able to make the titrations in their food habits.
And
So
how
that's a
early
great
do
way.
you recommend people starting this?
The moment you are detected and you start treatment, you should be monitoring your sugars.
Even in
and
the
it should-
borderline cases also?
Yes, because the patients who are pre-diabetic are the ones actually where aggressive treatment should be started, right? Because maybe all patients with pre-diabetes do not require immediate medications. We start them on lifestyle changes
And modifications.
and we keep monitoring the blood glucose to see that are they coming towards the normal range or are they progressively worsening and moving towards the diabetic range.
So basically,
Now, if they're moving towards diabetic range,
Yeah.
then it's time that we start introducing them on treatment.
Yes, yes. So basically, it is all about curing it or fixing it right at the bud.
Absolutely. I think, if you monitor well, you know when is the right time to start treatment and ensure that your patients do stay in the normal range for a long time.
One message you want to give out to all patients when it comes to glucose monitoring?
I think the one message that I want to give out is that if you're on treatment, or whether you're on treatment or not on treatment, you should be monitoring your sugars, by glucometer estimations. Not everybody requires a continuous glucose monitor because these sensors are expensive, and I think a lot of people affordability becomes an issue. But the glucometers are fairly cheap, and testing on the glucometers is not so difficult. So I think people should sort of consciously monitor their sugars and look at what dose titrations they need to do and ensure their blood glucose is in control.
So I want to hear out one patient story, which you remember, where this continuous glucose monitoring has done wonders or has improved, in the overall treatment plan of diabetes.
Lovely. So I think I had this patient, an elderly person, who came to me, and he said, I keep getting headaches. And when I wake up, I keep getting headaches. I can't explain. My blood pressures are normal. I have done scans and I've really not had any, abnormality in it. And I have no stress. I have nothing. I said, he's a diabetic. He was on aggressive oral treatment, but unmonitored, right? So I said, okay, wear a sensor. Let us see what is happening to
What's
you
happening inside.
in terms of your sugar controls.
Yeah.
And to my surprise, although the daytime sugars were fairly good, right, his night sugars were exceedingly low.
Oh.
Right. And that was when he got up in the morning also, he got up with a very low sugars. And one of the manifestations a patient can experience headaches. We just brought down his medication dosages, ensured that he was not in the hyper range, and all his problems just disappeared. So, it helps us to understand certain blinded facts that when we are not monitoring what is happening to the patient and you put the CGM on this patient, you are able to map out, what is the glucose journey in an individual patient. And that helps us to understand how much of aggressive treatment we need to do.
Okay. So now moving on to the next segment, which is about the rapid fire. Again, my favorite ones. So only diabetics need to monitor their blood glucose. Myth or fact?
True to a certain extent, because non-diabetic population, the body itself regulates it pretty tight. And as a health check, you may do it, but you don't need to do it frequently.
Biggest glucose spike culprit: white rice, fruit juice, or stress?
I think all three tends to cause it, right? It just depends on how your body is responding and the oral medications are working. All of three of them will tend to cause spikes. If you have enough insulin reserve, then it'll get offset. If you don't have insulin reserve and your sugars are uncontrolled, then all of them can cause a spike to happen.
Walking for 10 minutes after a meal can reduce your glucose spike. Myth or fact?
It's a fact, because when you start walking after a meal, there's a lot of glucose utilization, and you find if you're putting a CGM and you eat and you start walking, you find that there is a drastic fall. My wife is has noticed this. She monitors her glucose pretty much, and she told me about it, in fact, that when I use a sensor and I walk after a meal, I find that my sugars come down by 30 and 40 milligram
Oh,
percent.
wow.
Yeah. And this was also told to me by a friend of mine. Yeah.
Acha. So walking post a meal, definitely yes.
Yes.
Acha. One healthy food people are shocked to learn that causes sugar spike. A healthy food that causes sugar spike.
I think any carbs in any form, you eat, will tend to cause a spike in the sugars. So I wouldn't say that if you have a healthy food, why should your sugars really go up? What matters is the meal composition of that healthy food. That is the only fact,
Fact. Yes. Continuous glucose monitors are 100% accurate. Myth or fact?
I wouldn't say that it's 100% accurate. I think what we talk about is MARD values of how accurate they are, and most of the earlier sensors had very low MARD values, right? The appropriate MARD value that we look at should be about 10 at least, so 10 and less. What we look at accuracy of sensors is by MARD values. The earlier sensors had a high MARD value, which means they were less accurate.
Okay.
Today, we have got more sophistication of the sensors, and they have low MARD values. So we say a good sensor should have a MARD value of less than 10, which means that there is a relatively higher amount of accuracy they have.
Okay. What's worse for your sugar levels? Poor sleep or sugary snack?
I think sugary snack more.
Because it
Yes,
instantly...
it just suddenly, because they have got a high glycemic value. The moment you use a sugary snack, they just spike it up.
One glucose hack that actually works, in your opinion?
You combine glucose with a carb blocker, right?
Achha.
So I've had, there are studies to show that, okay, you eat 8 to 10 almonds before a meal, and then you have a carb, it doesn't cause a spike. Or you eat a whole bowl of, salads or sprouts, and then you have a carb, it doesn't cause a spike to happen.
wow.
All right. So that's why combination and combining and sequencing of
it
meals,
works.
it works.
Oh, lovely.
I know people where we've got oral agents, the carb blockers, like the alpha glucosidase inhibitors. They will go on a party, but they'll take one of these pills because it prevents the carb absorption from happening.
Yeah, sure. Eating fat with carbs always flattens your glucose curve. Myth or fact?
Yes, because when you eat fat, all right, it retards it sort of prolongs the emptying time, the stomach emptying time, and it sort of flattens out the absorption. So you don't get sudden, surge of the glucose in the blood because of a rapid absorption.
Should everyone in their 30s consider checking their blood glucose levels at least once?
Yes. And I'll tell you this from our organization, the RSSJ, the Research Society for Study of Diabetes in India. I'm the Secretary General of that body. We ran a campaign called as Defeat Diabetes, and we said that people should test their blood glucose at least once, right? And we wanted to sensitize the population to say that you should periodically monitor, because Indians by ethnicity are a high risk for development of diabetes. Correct? So we said, can we sensitize 100 million in 100 days? And can we sort of, make people aware that glucose testing is important as a routine? To our surprise, we could touch 128 million population in 100 days. And we tested 1 million population on a single day, which was captured by the Asia Book of Records.
Congratulations on that.
Yeah.
Congratulations.
And we got a lot of data to analyze on these populations.
Beautiful. One glucose myth you wish would disappear forever?
that I can't develop diabetes, right? I
Many of us
think,
have that.
many of us that if I don't check, I will not have it. I think it's an ostrich attitude. I think we all need to be mindful that as an Indian and as a race, each one of us can be at a high risk. So we should monitor our blood glucose. Of course, there are high risk groups which definitely require, but at least once in a way, you should monitor your blood glucose.
That's about that. Thank you so much. I think there was a lot of information which we discussed today, and most importantly, some shocking facts. Like, to be honest, I myself didn't know that consuming a bowl of sprouts before a meal can actually reduce your sugar spikes, and so many other facts. So I'm very sure that all these information is going to, help a lot of people,
Thank you so much.
including a lot of my family members. So I'm just definitely going to make them watch this podcast at least.
Thank you so much. I think it's been a pleasure to be here on this show.
Thank you.
And I think these conversations are very useful. I hope more and more people watch them because people do have myths. People do have lack of understanding. Maybe they don't get information from the right
Right
sources.
sources. Yeah, because
So-
internet is flooded with information,
Correct.
but not the right
Correct.
information.
Correct.
Always.
So these kind of information, probably helps a lot of people to understand
Sure.
what is the right way to manage the diabetes.
Sure. And
Thank you.
I'll talk to you, behind the scene about your next date.
Done.
Till then, wishing you all the best, sir. Thank you so much once again for coming on Sahyadri Health Talks. Signing off with Dr. Sanjay Agarwal.
Thank you so much. Thank you.
Thank you
you
so
very
much.
much.
Bye.